Hello, Psychology. This is the test review for Unit 2. So in this test review, we're going to cover the psychology of personality. We're also going to cover psychopathology and psychological therapies. So here are your items. I'll give you an overview of the items. They're not word for word, but they will give you an idea of what to study. If you have your notes written out, if you want to highlight the things that we've talked about, these are coming directly from the lectures. So also should come directly from the textbook as you read through. Okay, so during the Renaissance, abnormal behavior was believed to result from body fluid imbalances. According to behaviorists, disordered behavior is a result of a set of learned responses. The purpose of the DSM is to help psychological professionals diagnose disorders. The psychological problem formerly known as multiple personality disorder is now known as dissociative identity disorder. Treatment regarded for a patient who's receiving phototherapy has likely been diagnosed with seasonal affective disorder. Therapies that are designed to help a client understand their motives, to give them insight into their actions. These are insight therapies. According to Freud, the manifest content of the dream would be their memory of the people, places, and things in that dream. The underlying meaning of these would be the latent memory, the latent content. Carl Rogers' person-centered approach is non-directive because the client does most of the real work. Behavioral modification seeks to modify or change behavior. The most successful psychotherapy is that which has an effective therapeutic alliance between client and patient. The behavioral approach claims that shaping has an important role in dissociative identity disorder. Shaping, behavioral approach believes shaping has the largest role in developing dissociative identity disorder. Schizophrenia can best be described as a psychotic disorder. Psychotic disorder. People with personality disorders have excessively rigid and maladaptive patterns of behavior, ways of relating to others. People with personality disorders have an excessively rigid, maladaptive pattern of relating to others. And remember, this is an axis 2. These exist on the axis 2 of the DSM-5. Process through learning through observation and imitation is called modeling. Rational emotive therapy is a type of cognitive behavioral therapy. Advantage of group therapy is that groups provide a great deal of social support. Ancient people most likely performed trepanation or trepanning to release evil spirits. They thought it released evil spirits from a person's head, so they bored holes into their skull. Cognitive behavioral therapy hopes to discuss cognitive distortions and irrational beliefs as explanation for abnormality. A psychiatrist prescribes medication, whereas a psychotherapist performs talk therapy. Obsessions are thoughts and compulsions are actions. That's important to know. Obsessions are thoughts, compulsions are actions. Panic disorder with agoraphobia is where a person refuses to leave the house for fear of having a panic attack in a public place. Bipolar disorder would be a mood disorder with extreme fluctuations in mood, extremely elevated mood, also extremely depressed mood. Felipe Pinel is credited with the moral or humane treatment of those with psychological problems, and he's the first person to use the term mental illness. The meaning of the dream, as I mentioned before, would be the latent content of the dream. And the definition of personality would be the unique and stable way a person thinks, feels, acts over the course of their life. The unique and stable way a person thinks, feels, and acts over the course of their life. Somebody wants a new device, phone, and they decide to take this device and to steal it without thought of consequence. This is the workings of the id, according to Sigmund Freud. The id is responsible for it works via the pleasure principle. So it does what it wants, when it wants, without thought of consequence. To explain a person's personality, a behaviorist would instead look to early experiences of reward and punishment for specific behaviors. According to Rogers, anxiety and neurotic behavior result from a mismatch between the ideal and the real self. The 5-factor model of personality includes openness, conscientiousness, extroversion, agreeableness, and neuroticism. And the metaphor, angel, the devil, and me. The devil would be the id, conscience would be the superego, and the core of the self would be the ego. And that's according to Sigmund Freud's theory. Sigmund Freud's psychosexual stages focus on different erogenous zones, which he believed were the focus of a child in developmental stages. According to Freud, if our needs were delayed in a particular stage, we would become fixated. That fixation in certain stages, according to Freud, would be responsible for certain personality traits and certain personality types. According to Freud, during the first 18 months of life, the dominant source of sensual pleasure would be the mouth. The Neo-Freudian that viewed personality disturbances resulting from feelings of inferiority, that is innate to all, would be Alfred Adler. The third force in the school of personality is the humanistic view. The third force in personality theory. When one thinks of a value judgment in relation to personality, one is thinking about character. Maslow and Rogers were both humanistic psychologists. They believed that humans were always striving to fulfill their innate capabilities. Anxiety disorder. An anxiety disorder would include, so bipolar is an anxiety, bipolar is a mood disorder. Phobic disorder would be the best description of an anxiety disorder. So it's in that category. Severe depression that comes on without any external cause is major depression. According to Freud, when a mother is too permissive during the anal stage of psychodevelopment, the child becomes anal expulsive. If the mother is too intense, the child can become anal retentive. According to Freud, an anal retentive personality occurs when a mother is too intense during the anal stage of psychosexual development. If someone takes a NeoPi, they are measuring their level of openness, conscientiousness, extroversion, agreeableness, and neuroticism. In Gestalt therapy, the therapist is both active and directive. In Gestalt therapy, let me correct that real quick. In Gestalt therapy, the therapist is both active and directive. I wanted to make sure I gave you the right one, active and directive. Therapy that depends on identifying and changing distorted thoughts and unrealistic beliefs is cognitive therapy. Cognitive therapy. A therapist who is exploring the inner regions of a client's psyche would be a psychoanalytic therapist. A psychoanalytic therapist. And electroconvulsive therapy has been used for decades to treat severe depression. Severe depression. Therapy that involves talking things out with a trained professional is psychotherapy. And trait theorist who developed the 16PF was Raymond Cattell. Raymond Cattell. The kind of therapy that uses biological treatments such as medication, surgical methods, and electrical shock treatments to bring about changes in a person's disordered behavior is called biomedical therapy. Okay, so that's the test in a very quick flyover. That will give you an idea of what to concentrate in your study. Go back and highlight in your notes everything that I say about those things to give you greater understanding. If you want to go back and watch the portions of your lecture that deal with that, or go into your textbook online to take a look at these topics more, read over them, any of those things will help. Okay, so I'll post this and you'll have 6 or 7 days to review this before the test, and look forward to seeing you back online, and look forward to seeing good work. All right, take care. Good luck on this test.